There are already 8 million people with cancer today and 1 million new cases being diagnosed every year. Just like other segments of the healthcare industry, the oncology area is trying to figure out ways to become more efficient and more personal. I have with me now Stephen Bonner, who's the president and CEO of Cancer Treatment Centers of America. Welcome.
Thank you. It's great to be with you.
We've already talked about how big this market is from actually just a dollar standpoint, but is it very efficient?
I think that there are a lot of opportunities for greater efficiency throughout healthcare, and certainly oncology is no different. One of the greatest challenges that consumers face if they're coming to the oncology segment of the market is access to reliable information that will help them understand what they're dealing with, what the options are that they face for their treatment, where they can consider going, and also what's it going to cost for them to be able to access care that they value. There are also a number of efficiency opportunities in terms of delivery. Oftentimes a patient will get a diagnosis and they'll start trying to clarify what it is that they are dealing with so that they can then get into effective care. And it's not unusual for a patient with cancer, with a more complex form of cancer, to take 2 months or 3 months just to get through the diagnostic phase. That's very inefficient, especially from the point of view of beating the cancer. Once you know you've got cancer, time is working against you, so you want to get into quick therapy as soon as you can.
And you would think that this segment of people would be most motivated to really get things moving.
The oncology consumer is an incredibly motivated consumer and also a very intelligent consumer and an increasingly wise shopper for services. On our website now at cancercenter.com, we're hosting over 8 million unique visitors a year who are people dealing with cancer, looking for opportunities and looking for information. So they're into the game, they're looking for the information, they're trying to do a more effective job. They're very, very knowledgeable and motivated consumers.
What does the marketplace need to do to really address the needs of these people going forward?
There are several things, but we think right up front is first for all of us as providers to equip our consumers with our results information. How are we doing in treating their cancer? Do they live longer if they come to us? Do they live a better quality of life if they come to us? And what's the patient experience like? Is it something that they can enjoy and be able to move through, or is it unhappy and depressing and debilitating? So that's the first thing, is to just give them the kind of comparative information that they're used to having when they shop for any other consumer product in their lives. The next thing is price. You can't expect a consumer to shop intelligently if they don't know what the services are going to cost that they're looking at buying. And you can see in healthcare, when people have price information, they shop more wisely. They ask, why should I buy this service? Why should I buy it from you? Where are the other alternatives? If I don't do this, what can I do? And so we see consumers disciplining the market when they have that kind of information. The third and final piece that we're working on is helping them convert the quality differences and the price differences to something that really means something to them in their own economic situation. So if you are looking at two alternatives and one you're going to live longer than another, how do you equate that to your life? If it's going to give you a better quality of life so that you won't miss as much work while you're going through care, your family isn't as distracted, what's that worth? So we're working to also provide people with models that will allow them to convert the reality of the market into their own situation.
We've already addressed how large this market is. You have 4 centers already running, one more coming online. How fast and quickly do you think that Treatment Centers of America needs to grow to meet this need?
Well, that's a great question. Our current model is to create 6 centers around the country. And right now we have 2 in the middle of the country with Illinois and Oklahoma. And we have 1 in the Northeast in Philadelphia, 1 in the Southwest with Phoenix. And then Atlanta will be the 5th, and we're looking at the Pacific Northwest. That cuts dramatically how far people used to have to come to us for care and makes it much more accessible. But everything that we can see says that's not going to be enough, and we'll be looking at another wave of effective, efficient distribution. It may be more simple sites. Right now we have each of our hospitals is a very comprehensive and extensive array of technologies and therapies, and costs $120 million to open. We may surround those with places where people in their own communities can have a Cancer Treatment Centers of America facility where they can get great diagnostics and routine care, and then if they need the more complex care, we would move them to one of our regional centers.
Do insurance companies adequately address the needs of cancer patients now?
Some do, some don't. And cancer patients on Medicare have an enormous challenge in getting the care that they need because of the rates at which Medicare will pay. But we have wonderful relationships with some of the healthcare companies and some of the intermediaries. We're in negotiations with others. They're all looking at effective change as well. And where we don't have a contract, the insurance companies are asking many of the same appropriate questions that the consumers are asking. What does CTCA do that makes it important for patients to have access to you, to come into our network? How do you price, and what's the correlation of price and value? All very good questions, and ones that we're very welcome and are getting better and better at answering.
Okay. Well, Mr. Bonner, I've asked all my questions. Thank you for your time today.
Thank you very much. Good luck.
You're watching coverage of the 8th Annual World Healthcare Congress in Washington, D.C.